Our nursing program at Davis and Elkins College is unique because we are small enough to get to know our students on a really individualized level. So we have small enough classes that the instructors and the students as a group, we work together. So it's very cohesive. The students don't get lost in the shuffle. We are watching out for them. We're looking to see if they need help in any areas, making sure that they're thriving, succeeding in our program. So I think that's one of the main things, that we have a strong, individualized approach with our students.
I'm a senior BSN and our class has 12. So the professors get to know you not only as a student, but as a person, and they're super supportive in that. And I think bigger programs don't necessarily get that personal connection with all the professors.
In my class, there's 11 of us, so we can do study groups together, and it's not that big. We have a group chat and stuff, so it's very easy to communicate with them and become close because of how small it is.
For hands-on, we have 2 skills labs on campus, and then we have an off-campus skills lab, which is across the street from the hospital, so it's a whole 5-minute drive. We go do our sim lab, which is our situational stuff with sim patients. They can talk to us and we interact with them.
In addition to that, we also have senior level students that are student workers, and they will be in the lab to help the students. So sometimes they feel more comfortable asking a student, hey, can you help me listen to this, or can you help me find this?
It's hands-on, obviously, but it's very nice to be able to practice what you learn in the class on not a real person, but a simulation of a real person.
When I take students to clinicals, they've seen me sit in the floor and, hold a patient's hand, or that human part of it. That's something that we can't lose. That's something that we have to maintain. And that's one of my big focuses. I want to not only make them a good nurse, but I want to make them a great nurse, because there is a difference. There's someone that can do the job, and then there's someone that should do the job.